Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening. I'm your host of this podcast. Thank you so much for tuning in, where every single week I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement, wherever you are and however you might be listening to us today, on whatever platform you might be listening to us today. Thank you for taking some time to spend with me. This is episode 138, and today we're going to be talking about how to pick the best Medicare Advantage plan for you in 2020. Some things you should look for and different things you need to take into consideration. Medicare Advantage is something that has a lot of working parts, folks. If this is your first time listening to us, my name is Christian Brindle. I'm a Medicare health plan expert and specialist. I'm a licensed insurance broker. And I own a company called Christian Brindle Insurance Services, where we work with people on Medicare specifically, of all different shapes and sizes. We work with all of the largest insurance companies available in the insurance industry today, across multiple different states. Utah, where we're located, Texas, Florida, Oregon, Idaho, Colorado, and South Carolina. Again, that is Utah, Texas, Florida, Oregon, Idaho, Colorado, and South Carolina are the states that we do business in currently. We had a lot of growth in 2019, and now we work with people and have clientele in all of those different places. Okay. But today we're talking about Medicare Advantage, something that is very polarizing, of course. And we did an episode on the first of the year that, ironically enough, was about how it's very clear to anybody that pays attention that the industry is basically pushing you towards Medicare Advantage. And then today we do an episode about how to pick the best Medicare Advantage plan for you. I need to preface my comments by saying not every single person needs a Medicare Advantage plan. Not every single person should have a Medicare Advantage plan. It depends on your needs and preferences. Some of you need Medicare supplements. Okay. Now, that being said, Medicare Advantage is a great option for certain people. But if you don't pick wisely, it can be a nightmare. How many of you that are listening today have heard horror stories about Medicare Advantage? The most common one you hear, and the names change, but the story is typically the same. Let's say Sally is the name of our person in our example. Sally went to the hospital and she went and had a $50,000 surgery and then found out that it wouldn't be covered, and she was stuck with all of it because she was out of network. Dun, dun, dun. But that could have been very easily avoided if Sally knew what their freaking plan's network was before she signed up for it. Let's be honest about this, folks. Sally, in this example, has some sort or some portion of the responsibility, doesn't she? I mean, she said, yes, I'll sign up for this plan. She signed on the dotted line. She said, I do, when she chose to get married to this Medicare Advantage plan. Don't you think it would have been a good idea to know a little bit more about it? Now, somebody might say, well, she was pressured by a salesperson or something like that. Yeah, that's pretty crappy of that salesperson. But you still hold some of the responsibility if you say I do, if you don't understand the plan. You should never sign up for something that you do not understand first and foremost. Now, throughout our lives, a large portion of our lives is making choices, decisions between option A or option B. And in most things in our life, folks, let's say we go to the grocery store. I shop at Costco personally. Love Costco. And so let's say if I go to Costco and I'm buying milk, the choices are very easily laid out for me, right? I can get 2% milk. I can get skim milk. I can get almond milk. I can get soy milk. I can get whatever, right? Whole milk. I'm going to have these choices laid out in front of me, and it's very easy for me to grab the carton off the shelf, look at how much fat it has, look at how much sugar it has, if it has any, and compare the health benefits of the milk I'm looking at side to side. Those kind of choices in life are easy, relatively easy for most of us. Medicare Advantage is not like that. There is no magical shelf you can go to and see everything you need to know about every Advantage plan side by side. You might be able to see on, certain websites different Advantage plans side by side and their benefits. That way you can compare their copays and that kind of stuff. But they don't share with you how your prescriptions are going to be covered. They do not share with you how big or small that particular plan's network of hospitals and doctors is. And it's not like the other decisions we make in life. Medicare Advantage plans, folks, have a lot of working parts. Okay, let's count them down. You have the medical benefits. Anytime you have a Medicare Advantage plan, keep in mind, you're going to have, in most cases, depending on where you live, there are some areas that there's an exception to this, but you're going to have copays, co-insurances, out-of-pockets, maximum out-of-pockets, things like that you need to pay attention to. Some plans have really low copays and out-of-pockets. Some have really high, ridiculous out-of-pockets. Not all benefits are created the same. So you have that. You have the prescription coverage, which can vary wildly from one plan to another, not by the outline, not by the structure of the drug coverage. They're all going to have a similar outline, which is basically tiers 1 through 5, 1 being the lowest, 5 being the highest. All medications are placed in one of those tiers, and the higher the tier, the higher the copay, right? Pretty simple. Might have a deductible of sorts, might not. Maybe a few $100s that you have to meet for certain types of medications. Usually it's brand name medications, but not for all plans. But what makes a huge difference is the Advantage companies can take the same medication and place it in their own tier based on their interpretation of a medication. They can take a generic if they want to and classify it as a brand name. For those of you who don't know, tiers 1 and 2 are your generic tiers in the Medicare world. Tiers 3 and 4 are your brand names, and tier 5s are your specialty medications. So you can have 3 prescriptions that you take on a daily basis that Plan A has as tier 3s and Plan B has as tier 2s, which is a wildly dramatic difference as far as what you pay. You need to know how your prescriptions are covered on particular plan and how it compares to the other plans. The third thing is the networks of hospitals and doctors that you're dealing with. Plans have wildly different networks of hospitals and doctors. Number 4, what kind of hoops does the plan make you jump through? Do you need a referral? Is it the type of plan that has what's known as a gatekeeper doctor, where you have to get a referral to see a specialist every time or every couple of times? It's kind of a nuisance, isn't it? Some people are okay with that, but a lot aren't. So far we've got medical benefits, copays, out-of-pockets, prescription coverage, networks, hoops to jump through. Number 5 would be extra coverage that you can get. How much dental coverage can you get? How much vision coverage for your glasses can you get? Hearing aid coverage, does your plan have it? Do you have any other kind of extra benefits? Well, in this episode, I'm going to count down everything that you need to do to make sure that you're getting the best Medicare Advantage plan in 2020 and that you're not on a mediocre plan that you could do better. Because believe it or not, millions of people all across the United States of America that have Medicare Advantage plans are not on the best one that they could get for them. And we want to avoid that, being you. I'm going to take a quick break, hear from this week's sponsor. I'll be back in segment 2, and I'll tell you exactly what you need to look for to get the best Medicare Advantage plan in 2020. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me through that break. Today we're talking about one of my favorite topics, Medicare Advantage plan, and how to get exactly what you deserve, what you need to look for, what you need to make sure that your plan includes if it's available in your market. So let's get a couple of things out of the way. Medicare Advantage plans are going to be different from market to market, from state to state. Depending on where you live will determine what's available and what might not be available. So keep this in mind. Not every benefit and every perk I'm going to discuss today will be available in every market, but in a lot of markets it is there. So let's talk about number one. What do you need to look for when it comes to copays? Well, you want to make sure that you're paying the lowest copays possible. Your plan might have a $50 specialist copay, and you might see 2 or 3 specialists a month, which can add up pretty quickly, folks. But there could be a plan available that's the same cost as your plan, could be cheaper than your plan in premium, that has a $25 specialist copay, a $30 specialist copay, a $35 specialist copay. Boy, wouldn't that make a difference in your everyday life? Wouldn't that make a huge difference? Maybe you're paying $10 every time you go see your primary care physician, but you could be paying nothing. A lot of Medicare Advantage plans in a lot of places have $0 primary care doctor copays. I'm not promising that this will be available in all the markets, but the point I'm trying to make is you want to make sure that you're getting the lowest copays you possibly can. And you'd be amazed how often there's a plan out there that you didn't even know about with a good insurance company that's a perfect fit for you that can lower these copays. Sometimes it can be offered through the insurance company that you already have. A lot of times, insurance companies have multiple different Medicare Advantage plans in different markets that you can pick from. And it's not your fault if you weren't told about it or you weren't kept up to speed about it. Not everybody's like my company, folks. Not everybody's going to call you each and every year that has a plan with us and go over changes and go over new plans with you. We do that year in and year out. It's very important. So check around. See if you can get the lower copays. And if you can, then what you need to do is see if the other things fall into line. So check your medications. Have your agent do it. If you don't trust your agent or you feel like they're not maybe telling you necessarily the whole story, go to Medicare.gov and do it yourself. It's easy. I have a step-by-step tutorial on showing you how to compare your medications on YouTube. Go check it out. You can do it. It's very easy. You can do it in any market just by putting in your zip code, your medications, you pick the dosages. It's fairly accurate. It's not perfect, but it's fairly accurate. You can see if the plan covers your medications as well as your current plan or better than your current plan. You can see if you save money on medications. The difference between a tier 3 copay and a tier 2 copay is vast. And there could be a plan out there that covers your medications better than the one that you're on now, that you might not even be aware of. So see if you can get the prescription compared. You can see every plan available in your market if you do it yourself on Medicare.gov. www.medicare.gov, definitely not a perfect website, but it's a fairly good tool for comparing your medications. It's free. Anybody can use it. Okay. The next thing you want to check is how big is the doctor network? In our in segment 1, we talked about Sally. Sally was our example on someone that went to a hospital, had a surgery done, a planned surgery, an outpatient thing, walk in, walk out, or maybe she spent the night. I don't know what the case might be, but you hear about these stories all the time where someone went out of network, they were billed all of it they didn't know. You can't rely on your doctor's office, the hospital, or anybody that works for the provider to know what insurance they have or what insurances they take because they don't know. I know it's ridiculous. It blows people's minds that their doctor's office cannot tell them accurately what plans they take. I've done episodes about this in the past. Just know you can't rely on them. So that's where an agent comes into play. That's where a good agent that knows the market can come into play. If you live in one of the 7 states that we discussed earlier in this episode, I can tell you exactly what networks you're looking at with every plan. That's what my job is. But you don't necessarily have to work with us if you live in one of the states we're not licensed in yet. Make sure you're working with an agent because that's where they come in handy. A good one will anyway. Knowing which plan has a big network opposed to a small network. In my opinion, I think it's a very, very valuable commodity to have a plan that has a bigger network opposed to one that has a smaller network. Even if that another plan with a smaller network covers all your specific doctors, you might need to go to a different facility one day. Maybe you develop a condition that is a specialty at this other facility. More options is better than less, point blank. Try to get a plan with a bigger network if you can. And they're out there, I promise. These are the things that I recommend looking for, a balance of all of these things in a Medicare Advantage plan. And they exist, I promise. So low copays, low out of pocket if you can. The best prescription coverage available to you in your market. A big hospital and doctor network, lots of choices, lots of options. You don't want a quarter of the hospitals in your market, in your area, available to you. You want all of them if you can get it, or 90% of them if you can get it. It's possible. I promise. It's very, very possible in most places. Okay? What are the other things you should look for your Medicare Advantage plan to cover? Well, nowadays in 2020, most Medicare Advantage plans come with some kind of dental, but we're seeing more and more plans that come with $1,000 a year of dental benefits built right into the plan. See if you can find a plan that fits the criterias we talked about in the first 3 steps that also can carry dental plan benefits like this. At the very least, you should get preventative dental on most plans. At the very least, cleanings, x-rays, examinations. Every 6 months, no copay. That'd be nice, wouldn't it? I don't know about you, but every time I get a cleaning, x-ray and exam, it's usually, if I had no insurance, it'd be probably $150 each time. If that's you, if you could at the very least get that taken care of, it'd be worth it, wouldn't it? But, like I said, more and more Medicare Advantage plans are adding more and more dental. It's not uncommon in a lot of places. Now, this isn't everywhere, but it's not uncommon in a lot of places to have a plan that can pay out $500 to $1,000 a year for dental benefits, for comprehensive dental. Bridges, crowns, root canals, fillings sometimes. Included into the plan, not with a rider. See if that's available in your market. Chances are something like it is. But in my opinion, you don't want to sacrifice the first 3 things we talked about to get more dental. So it has to match up. Sometimes you can get a grand slam where you can get all of the above. But I think that's probably lower on the totem pole than the big network, low copays, and good drug coverage. Depending on your needs, of course. But see if you can find a plan that has the other things involved. It's more common than you might think. You don't usually have to sacrifice one without the other. Sometimes you do, sometimes you don't. You're empowered by knowing your options. What kind of glasses coverage can you get on this plan? Can it pay out $200-$300 a year? Maybe. What about hearing aids? Do you need hearing aids? Well, you can find plans that can pay a large sum of the hearing aids. Some are more diverse than others. Some are very restrictive. Some are not. See what kind of hearing aid coverage you can get. Most Medicare Advantage plans nowadays are going to have some kind of hearing care. A lot of them will have hearing aid coverage as well. In some markets, there are plans that have a benefit known as Medicare Part B Giveback. Giveback programs. What do I mean by that? Well, everybody that's on Medicare pays the Medicare Part B premium. We've talked about this a lot on this podcast. In this year, in 2020, that Medicare Part B premium is $144.60 a month. If you're in a higher tax bracket, they can charge you more for that. But everybody pays that. If you're drawing enough Social Security, usually they take that out of your Social Security check automatically. You don't even see it. It doesn't even show up on a statement sometimes. So what a Medicare Part B Giveback program does is it takes X amount of dollars and it refunds it back into your Social Security check for you. Could be $50 a month. Some markets I work in, it's over $100 a month. Boy, wouldn't that change your life? To have your Medicare Part B premium essentially almost all the way paid for you and you only pay $20, $30, $40 a month of it? Even to have them pay $50 a month of it. Wouldn't that be nice? You see those a lot in Florida. You don't see those everywhere, but check and see if it's available in your market. Boy, those are life-changing, aren't they? Medicare Part B Giveback, where they refund some of your Part B premium back into your Social Security check. Over-the-counter items. We see this in a lot of markets now. See if your plan has some over-the-counter item essentials, folks. Over-the-counter essentials meaning aspirins, ibuprofen, fish oil, Band-Aids, vitamins. Over-the-counter essentials. A lot of plans that carry it now. They give you an allowance. Sometimes it's monthly, sometimes it's every 3 months. You can order from their catalog, and depending on the plan, some are very restrictive, some have a very wide diversity, but sometimes the plan carries that, and you order it from them and they ship it to you in most cases. Completely free, as long as you stay in the allowance. Cool, right? These are things you need to be looking for when you're picking out a Medicare Advantage plan. These are things you need to pay attention to. Does the plan let you go out of network? Do you need to go out of network? Is it a PPO or an HMO? Referrals or not referrals? If you don't want referrals, make sure the plan doesn't have referrals. Sometimes it can be in the fine print, folks. These are things you need to keep in mind. Medicare Advantage plans are not just one size fits all by any means. There's a lot of working parts that you have to be aware of. It's not like picking milk up off the shelf at Costco and looking at the back and the ingredients. There's a lot you need to understand. There's a lot of working parts, but if you take my advice, if you heed my words when you're picking a Medicare Advantage plan, or if you're on one already and you're wanting to compare it, you can potentially save yourself a lot of money every year. Don't go anywhere, folks. I'm going to take another break. I'll be back with my final thoughts on this episode in segment 3. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me all the way to the end. I hope you got a tremendous amount of value out of this episode today, and I'm just pumped to be in 2020, to be in the next decade, and I am so excited for some unbelievably helpful episodes we're going to be bringing you to begin the new decade. Okay? Just keep this in mind. Make sure that you understand every facet of your Medicare Advantage plan. Make sure it fits your needs specifically. Make sure you're getting everything, every drop you can out of it, and it's providing all the benefits you can possibly need, and you're going to be in good shape. It's not a bad thing to ask questions that you hear on this show to your broker. Because chances are, a lot of times, your broker's not telling you everything you need to know about what plan's available to you. So they might be, but they might not be. So ask them questions. I encourage my clients to ask me anything. I have nothing to hide. When I'm making a recommendation, I carry all the companies. I'm not hiding anything from anybody. But some brokers do. If you don't trust your broker, and you live in one of the states that we're licensed and appointed to do business in, we'd love the opportunity to be able to help you. If you're on a Medicare Advantage plan now, and you think, I can't change till October, not necessarily. There's a second enrollment period called OEP. Stands for Open Enrollment Period. It goes from January 1st to March 31st. I'm not supposed to talk about it too much. The government doesn't want you to know about it, but you're able to change your Medicare Advantage plan one time, whether it be from Medicare Advantage to Original Medicare with a supplement, or from Medicare Advantage to another Medicare Advantage plan. You can change one time during that time period. Again, our states are Utah, Idaho, Oregon, Colorado, Florida, Texas, and South Carolina. Utah, Idaho, Colorado, Oregon, Texas, Florida, and South Carolina, where my company, Christian Brindle Insurance Services, can work with you in. Our office number is 801-255-5340, 801-255-5340, or if you're more comfortable with shooting me an email with a question, I'd be happy to answer the best I can. My personal email, folks, is christianb@xmission.com. Christian, Christian, B as in boy, at X, the letter X, Mission, MISSION.com, ChristianB@xmission.com. Make sure you're getting the most out of what you have. Because after March 31st passes, and you're on a Medicare Advantage plan, you are stuck until October. Unless you have some kind of life-changing event. We'll be doing an episode this month about what situations can you change outside of the enrollment periods. Life-changing events, special election periods is what they call them. Those are things you need to know about, and you may qualify for one, you never know, but we're in that second enrollment period right now. Take advantage of it if you feel like you can do better on your plan. Thanks so much for listening, folks. As always, if you're listening to us on a platform that allows you to do so, please subscribe. If you're watching this on YouTube, please subscribe for future content and videos. We put up all kinds of educational Medicare helpful videos on YouTube outside of the podcast. Podcast goes up as well on video, but we also put up all kinds of videos on YouTube that can be helpful. Okay, we just put up a video on YouTube this week that was called where I ranked, in my opinion, the top 5 Medicare supplement plans going into 2020 in order, and I explain why we ranked them in that category. So go back and listen to that video on YouTube if you'd like. But also leave us a 5-star review if the platform allows it. It helps us reach more people just like you who need to hear this information. Thanks so much, folks, for giving me your time, spending some time with me on a weekend, and we'll be back on Monday. Take care.